Hi, Lucy here. Welcome to the Holistic Therapy Interviews. How would you like to have lots of needles punched in all over your body? Well, today we are going to be talking acupuncture. So it's not going to be a painful experience. It's going to be a wonderful experience. I have with me today Amanda, all the way from Shropshire. Hi, Amanda.
Hi, Lucy.
And first of all, before I ask you about your story and how you came into acupuncture, I'd love to share with our audience a little bit more about your background. So, Amanda has studied and practiced traditional Chinese medicine since 2000, having lectured at acupuncture colleges and gained a significant reputation for her work in Bristol, helping women to conceive naturally through IVF. Her understanding of Chinese medicine and Western fertility protocols has helped many people heal from new diseases, which are mainly inflammatory, using nutritional supplements and Chinese herbal medicines. Amanda has the ability to use the Chinese model to identify illnesses quickly, to ask for specific tests to be run, as well as to communicate with GPs as to what might be happening. Her ability to connect emotionally uses psychological frameworks such as the Chinese medicine lens of the 5 elements, as well as her own personal experiences. Today, we'll be focusing on acupuncture. So, Amanda, I'd love you to share your story and how come you got into acupuncture in the first place?
Oh, thanks, Lucy. I've, like most of my life, I've kind of stumbled into things and they've generally worked out. But my first career before 2000 was as a consultant for the setting up and the development of call centres. So it was a very high octane job in the 80s and 90s, setting up databases and direct mail and processes and people and all that sort of thing. So it was very much a work hard, play hard job. And I didn't really look after myself particularly well. And with a lack of what I knew was good food, particularly being a vegetarian at that time, I didn't eat well to complement that. And with stress from work and traveling, I became very tired and quite ill. And as a result of that, emotionally quite depressed, wondering what on earth I was doing with my life, feeling so rubbish, but with such a huge demand on me. Luckily, a friend of mine was working in the same building and she had been training in Chinese medicine. I'd always had I've always been a bit fey as in regards to energy, but there just wasn't any kind of things around at the time that working with energies, it was all very new age. So when I went for acupuncture, first of all, and how I felt afterwards, I was just absolutely blown away. I had a series of acupuncture sessions with her, and it wasn't just that I felt so well, it was how she knew what was going on in my body without me telling her. And just by simply feeling my pulse and looking at my tongue and asking me a load of other questions, she told me, "Well, you're vegetarian, aren't you?" And I said, "Well, yeah, how do you know?" And she could tell by a quality of my pulse. So I was just absolutely amazed by this. And I thought if I felt this well, there were loads of people I thought would benefit from Chinese medicine. And so it all appeared at the same sort of time. I was disenchanted with my job. I sold my belongings. I rented rooms out in my house and I took myself away to College of Integrated Chinese Medicine in Reading for 3 years and was taught both Chinese medicine and the 5 element aspect of Chinese medicine. And so my passion arose. And I love that little sentence when people say, when you're born, a daemon tells you what you're meant to do with your life, and then you spend your life trying to remember. And I really felt like I'd come home. It was like, oh, crikey, I'd found out what I had meant to be doing with my life. And I feel incredibly grateful that I have found that. And I think it's such an incredible thing to have as a force, which really dictates everything how I do with my life. I see my life through a Chinese medicine lens now.
Oh, that's
So,
amazing.
so
What
that's
a,
how I got to Chinese medicine.
yeah, that's a fantastic story. I love the part about selling all your belongings and renting out your rooms and just going for it 100%. And I think
Absolutely.
that then shows in the fact that how well you've done since, and how well your clients have done since, because it's that passion and that new belonging to something that you've found that was like a calling, I would say, to you.
Without a doubt. I remember I did a silly little job just to pay the mortgage whilst I was training, and in the end I cut that job off as well. And I remember it was a Monday morning, and I sat on the sofa with my head in my hands to go, I've got no income, I've got no clients. And the phone rang, and a lady said, "Is that the acupuncturist?" And I just knew from that moment that the road was clear, and it was just straight through. I never looked back. I've not worried about it. It's just happened. It was absolutely a calling.
Okay,
Yeah.
so fantastic. So our audience, if they are looking at acupuncture for the first time, because I know from my experience, it was something I knew about, but it wasn't something I was going to do, but I have done it. So if somebody is at that stage and they're looking at getting into acupuncture and having some sessions, what would you say are the main things to have acupuncture for? Is there kind of a list, or does it cover a load of things?
It's a really good question. And I think this is probably the part where educating people who are watching this is really important. Rather like mindfulness in Buddhism, mindfulness has been taken from Buddhism and put as a separate entity, if you like, or a separate event. And acupuncture has been taken as a event out of Chinese medicine and is almost being treated in isolation as acupuncture. And that's okay. It's just that the public need to realise that anybody can call themselves an acupuncturist. Unfortunately, we haven't got protection of title. And acupuncture is just inserting needles into the body. And once you're trained in inserting needles into the body and you know where the acupuncture points are, you're essentially doing acupuncture. Now that's brilliant because it does work. However, there is a lot more that can be done around it if the whole model of Chinese medicine is taken into account. So what I mean by that is if you go to somebody who practices acupuncture, who's a GP or a physio or a chiropractor, or somebody who's trained within 2 weeks of acupuncture to understand where the points are and know how to put the needles in, then you're looking at a much more diluted version of acupuncture. And in fact, what the Western professions perform is usually trigger point acupuncture. That's so if it hurts there, we'll put a needle there. So the Western profession has realized that acupuncture releases dopamines and serotonin, which is brilliant for pain relief. It still doesn't understand why it does it. And really, the Western profession just simply don't have the tools to measure how acupuncture works. They do realize that if a point on the stomach channel is needled, then the part of the brain that controls the stomach will light up. But they don't understand the mechanism particularly for how that works. And I think it's quite difficult even for me to try and explain that. It's working across myofascia, which is the very thin covering around muscles. And the acupuncture points are electric. They have an electrical charge. So when you put a needle into an acupuncture point, you're creating an electrical impulse, which depending on how the needle is inserted, which direction it's going in, how deeply, how shallowly, will incite a reaction. So the Western profession realised that, and that's all well and good. But if the members of the public have gone to pain clinics where acupuncture has been performed, if they're not clear of pain within 6 weeks, there's nothing more that the practitioners can offer. Whereas I've been trained in Chinese medicine, and so 4,000, 5,000 of us around the country, and we've got a huge arsenal of other tools that can be used in addition to acupuncture. So whereas the Western people will say, if there's pain, I will probably use Largent testing for, but I want to find out why the pain is manifesting where it does and what's causing it. And it may not be that I even use that point. It may be that because of the pulse, and it's a woman, that I can tell that she's pregnant even before she knows she's pregnant. So I absolutely would not use that point because it's contraindicated for pregnancy. So it's these very subtle nuances of using acupuncture, which will work for everybody in whatever condition they have, as long as it's not bone related, it's not a problem with the bones, or it's not a problem with the tendons.
Okay.
Because the theory of Chinese medicine can be translated to any Western disease. And what I mean by that is the spectrum of disease which Western medicine hasn't split up. So, for example, if someone's got hay fever or asthma, they have hay fever asthma. There's no spectrum of it from bad to worse. Well, there is. Then there's COPD, but the same medicine will be given to each person, regardless of other symptoms, and it's just trained at the asthma. So in Chinese medicine, there are multiple manifestations of asthma depending on the signs and symptoms of the person, and dependent on what their tongue and their pulse is doing.
I was going to
And
say, I'm just going to stop you there because you've
yeah,
got, I know we spoke before, and you talked about the pulse and you talked about the tongue. So understanding that you can go to those different levels in specific areas is fantastic. And understanding that it can do a huge amount of symptoms, apart from the ones you've just said there, is great for our listeners. But if somebody's going to an acupuncture session, explain about the pulse and about the tongue for us, Amanda.
okay, so the best example I could give you was me hanging around fire stations and parties, trying to get as many combinations of pulse and tongue pictures together so that I could develop this very quick way of diagnosing people's illness. So, and it's rarely wrong. So by looking at somebody's pulse, it gives the practitioner a snapshot of the last 10 days generally. And there's so much information on the tongue. So the colour of the tongue, the shape of the tongue, where the colour in the tongue is it at the sides or at the tip? Is it more towards the back? Is the tongue geographical, as in, are there big peeled patches on the tongue? Do the lines go horizontally or vertically? Are there teeth marks in the tongue? And all of these visual symptoms tell me about their health immediately. So, for an example, if I met somebody who had a thyroid problem and they either hadn't been diagnosed or they'd come to me with pain and it was specifically in one place and it ached and it got worse when they moved, and they were a little bit overweight but quite cold to touch, I would expect their tongue to be wide and with a white coat and quite flabby and a little light pink, but just like a really wide tongue, just cold. And I would expect their pulse to be in the places that I'd be feeling, to be really slow, to be deep, like I'd have to push really hard to feel the pulse. And it would just be struggling, as though somebody was just out of energy, which is what somebody with a thyroid problem has. So it would indicate to me that this person energetically was cold and deficient, and therefore I would need to heat them up and tonify their energy. So, as an example, if I saw that same tongue, the cold, flabby, pale tongue, and their pulse was racing at 80 beats a minute and was bouncing up and reaching my finger, if they were a young woman, I would think that they were either about to ovulate or they were pregnant. It also could indicate where the pain was. And if it's at the bottom of the pulse, it's usually indicating the knees and the back. So I could tell where the pain was coming from, even if the pain wasn't manifesting there.
Oh.
And if none of those things were true, if they weren't ovulating, pregnant, or in pain, then that type of pulse would be telling me that they're about to be ill. Within the next few days, they're going to have an illness. And if the lung pulse is full and bursting, then they're probably coming down with a cold. So Chinese medicine is really predictive, and a lot of the Chinese doctors simply look at the tongue and the pulse. They don't ask anybody for their symptoms. They just feel the pulse, look at the tongue, and know exactly what to do.
That's
And this It's incredible, isn't it? And this type of knowledge in the body is taught to people who are on a 3-year degree or equivalent program. And you'll tend to find that the GPs and physios and chiropractors don't use that deeper level of acknowledgement of the body.
And so
which I think
if somebody's looking for somebody that's got all of that, Amanda, is there like a website or somewhere they can go to actually find those people that have done the same sort of training as you?
Yes, so the British Acupuncture Council will show all of the practitioners who've undertaken a 3 or 4-year degree course who are part of the British Acupuncture Council, or there is the Association of Traditional Chinese Members, which tends to be the cohort for the Chinese practitioners within the UK.
Okay, fantastic. Now, I know a question that will come up is, does it hurt?
No, it really doesn't. It's the needle actually touches the acupuncture point, which is full of chi. And because that point is electrical, the sensation when the needle hits that point is more of a ooh rather than ah.
Now.
And then it's a sensation that is so unique, and I expect feedback from all of the acupuncture points. I want somebody to go, yeah, 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 because I know I've got the chi, but I can also feel the chi through the needle as well. So it's a good way of knowing A, you've hit the spot, and B, the strength of the chi in those places. So it gives an indication of someone's energy. And apart from the tongue and pulse, there is nutritional advice, which is based on the temperature of food. So again, going back to somebody who's got a thyroid issue, they tend to be cold and damp and stagnant and deficient. All these wonderful words. So advising them to eat warm foods, which are easily digestible, and avoid cold foods. And cold foods would be obviously things like melon and food like pears, for example, which are energetically cold. So the Chinese theory ties up nutrition by the type of food that the food has on the body. And the Chinese have known about this for years. They know when they go into a restaurant, they know if they're cold and damp, they'll ask for a hot, damp, drying soup because they know their constitution. We have no model within Western medicine that tells us what our constitution is. We've got no idea. Whereas the Chinese know that they are hot, yin deficient, and blood deficient, for example, and they would be somebody that you would see who's quite red in the face, thin, and quite lined. So the type of body that I see coming into my clinic tells me, particularly after menopause for some women, just where their health issues will occur, because women tend to split into 2 groups, either cold and heavy or thin and hot, and the corresponding illnesses will arise from that constitution as well. Yeah. So apart from acupuncture and nutrition, there's obviously Chinese herbs in our arsenal, and there's also other techniques which can be used for pain, which have kind of translated over to the Western professions. There's a whole heap of
other tools in your toolbox.
Other tools, yeah, absolutely.
Okay, so we'll come back to acupuncture, and we'll come back to you putting the needles in. Does that, when you put the needle into and you find the chi, are you moving the chi from one place to another? Are you increasing what's happening when that needle goes into that point?
Good question. So there will have been a diagnosis done just prior to that, and a set of intentions, if you like. So if, for example, I need to move the chi or I need to tonify the chi. So if I need to move the chi, the level of the needle with the acupuncture point will be in the direction of the way that the actual channel moves itself. So, for example, if I was moving on the bladder channel, I would start with the acupuncture point in the eye, or probably just on the eyebrow. People are a bit scared of the eyebrow, but that's where the actual channel starts, and it ends up on the end of the little toe. So it would move the energy all the way through the body. If I wanted to tonify the energy, I would put the needle in, turn it and bring it out immediately, and then put my finger over the hole. So it actually stops the energy coming through. And I would probably use heat on that point as well, if heat was appropriate to use. I would either do that using what's called a moxa stick, which is mugwort, a herb that you set fire to, or a heat lamp, and a heat lamp is significantly safer. But you can actually put the moxa on the end of a needle and burn it so that the heat comes through the needle. And a lot of practitioners use that method to warm one specific place. And then, because all the channels are connected to each other, it will set up a chain connection to other organs as well. So if you choose one particular point that you know has multiple channels elsewhere, you're tonifying the whole body with one position.
Fantastic. So it's moving through the body by what you're doing with the needle and with anything else you're using from that toolbox. Fantastic. Absolutely. It's fascinating. Yeah. Amanda, I could talk to you for hours. Right. But what I'm going to do, we're going to come to our last question here, and I'll just quickly go over things for our audience. But if you could let us know 3 top tips for our audience if they're thinking about having acupuncture, what they might do, and it would be fantastic. So really, in a nutshell, what Amanda has said is that acupuncture is, it doesn't hurt, but if you really seriously want to get the best acupuncture, go to the websites that Amanda spoke about, because they are going to be the practitioners that have studied for 3 or 4 years, and they've got lots more tools in their toolbox than your chiropractor or your doctor that might have just studied for a couple of weeks. And it covers a lot of different things. So if you're not sure if it covers the challenge that you've got at the moment, phone a practitioner and find out if that's something that they can cover and help you with. Okay, so Amanda, back to you for your 3 top tips, please.
So I'm sure people who are watching this are thinking, oh, I'd really like to find out a lot more about Chinese medicine. But the issue with Chinese medicine is because it's an integrated theory, it's not learned linearly. So you can't learn it from a book. Every book on Chinese medicine is a textbook. And I think some people get to a point and go, I have no idea what's going on, because it's everything's connected. However, Dr. Daniel Kean, who was a Western doctor, has written a book called The Spark in the Machine. Ooh. And this book explains the science of acupuncture, whilst also explaining the mysteries of Western medicine. Western medicine is difficult to learn, easy to practice. Chinese medicine, it's difficult to learn, but easy to practice. So Daniel's book is a very clear way of how acupuncture works alongside the Western model of reductionism. It's a fascinating read. So that's my top tip if you want to learn more about Chinese medicine. The second tip is that if you do have some issues at home and you want to try some of the acupuncture points, then there are some really good books on acupressure that you can buy. And what you can do is get dehydrated chickpeas with a bit of sellotape and sellotape those to the acupuncture points. So if you have a headache, you could use large intestine 4, which is just on the side of the thumb here, just by manipulating it or by putting a dehydrated chickpea on it. And finally, absolutely go to a Chinese medicine practitioner. You'll get a truly integrated, amazing view on your health. And certainly for people who've been in practice for more than 5 years continuously, you'll find people who know more about you than anything else and will be able to treat you as an individual, which will be telling you the doses of supplements, what food to eat. And it's incredible how one-to-one healing happens with a good practitioner. So those would be my top tips.
Fantastic. I love it. So thank you so much, Amanda. Please, for our listeners, there'll be another video coming up on screen now. So do click on that and I will see you over there.